Women around the world are having fewer babies in what some are calling a baby bust. United Nations data showing birth rates fell by 2% in 2023 compared to the year before. The U.S. fertility rate falling to a record low since 1979. Other countries, including India, Japan, and Italy, also dealing with the same fertility crisis. Many government leaders worry about a decline in the workforce, economic growth as a result of fewer children in society, some even calling it a matter of national urgency. Board-certified OBGYN Dr. John Marchand is with us. Dr. Marchand, thank you for your time. Why do you think this is happening? What are you hearing from patients about childbirth and the desire to have kids?
Well, there's a lot of reasons this is happening. I'm certainly seeing it in my own population as a board-certified OBGYN as well. One thing you've got is a higher prevalence of C-sections. The C-section rate in the U.S. is over 30% now. So you really got all of those women, both going through more suffering following delivery and having the option to tie tubes at time of C-section. In addition to that, a lot of mothers are having babies older in life. They're making the decision to take care of careers or education matters first and waiting to have their children until they're older, which of course is usually going to mean fewer children and is going to raise the possibility of complications or more problems with those pregnancies. And of course, elective termination also plays a role. We had 3.59 million births in the U.S., but we did have 900,000 elective terminations as well. So having the option for elective termination essentially throughout the U.S. also plays a role in that number.
Yeah, several major factors. I'm curious, you mentioned C-sections. What's leading to more C-sections in your practice and others across the country?
Well, unfortunately, the answer to that is just C-sections. We've had the ability to perform C-sections safely for the last 100 years. We're talking usually about babies that were just a little too big to come out. And once we get those babies out safely and they're healthy, well, those genes stay in the pool and they grow up to have babies that are just a little bit too big to come out again, unfortunately. So the C-section rate for the safety of babies is rising. And although it's a good thing that these babies' lives are being saved, it is going to self-perpetuate. Having more C-sections, and of course, every C-section, it's going to leave a little bit of a worse taste in your mouth than a vaginal delivery where you can recover so quickly. And of course, with every C-section, you've got that easy possibility of tying tubes or actually removing tubes while we're in there, which gives permanent sterility if the mother desires it.
Are there certain demographics where you're seeing lower birth rates, desire to have kids?
Yes, in my population, I just don't have the same amount of women in their 20s having births that I used to see. It hasn't changed much in the teenage population. We have about the same amount of teenage births, but women in their early to late 20s are having less children, and more women I'm seeing are putting that off until their 30s, until their college education's out of the way, or until they've got their career choices out of the way. And unfortunately, if our goal is to hit that 2.3 babies per woman, that marker that Elon Musk is always talking about how important it is to avoid population collapse, women are going to have to start having babies a little sooner and have more of them.
What are the biggest questions, the most common questions that you get from expectant moms right now?
Well, I get a lot of questions about where family planning should work into their life plan. I try to encourage all women to have all the babies they want prior to 35, because after 35, although there's no magic event that happens exactly at 35 years and 0 days, that's traditionally been a marker where the risk of Down syndrome is higher, the risk of chromosomal syndromes is going to be higher, and it's going to be a riskier pregnancy for both mom and baby. Maladies of pregnancy like gestational diabetes, preeclampsia, gestational hypertension, those are going to affect older moms more. So I really do encourage all of my patients to have their children as early in life as possible and try to get all their children born before 35 if that's possible.
Yeah, and find a doctor you know and trust who can give you a lot of that information that's so important as you make this decision. Dr. Marchand, thank you for your time. Appreciate it. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.